to defend our liberty and unity. Oh, sons and daughters of Africa, flesh of the sun and flesh of the sky, let us make Africa a tree of life. Let us all unite and sing together to uphold the bonds that frame our destiny. Let us dedicate ourselves to fight together for lasting peace and justice on earth. Oh, sons and daughters of Africa, flesh of the sun and flesh of the sky, let us make Africa the tree of life. Let us all unite and toil together to give the best we have to Africa, the cradle of mankind and font of culture, our pride and hope at break of dawn. Oh, sons and daughters of Africa, flesh of the sun and flesh of the sky, let us make Africa the tree of life.
So let's make Africa the tree of life is an inspiration from the anthem that was sung by the Rwandese choir group. And I just want to welcome everybody to our session today. It is a Monday. I don't know, it is Tuesday actually. We were to have this session last week on Monday. Unfortunately, we had to push it to this day. So I hope everybody is fine from every part of the continent or East Africa you're joining us from. I want to officially welcome you to this session here. We're going to be having different presentations, networking sessions, and also just a moment of reflecting on the important topic that we are here gathered today, the digital health equity, especially on the Eastern African regional economic community. So just want to officially welcome everybody, and I will just give an open floor if you're able to share your name through a chat box, through our chat part of the Zoom. Also, if you're able to just raise your hand and share with us your name, your country, and what you're looking forward to this session today. So that will really be important. Before I introduce our speakers, who are already some are already here, some are on the way. So I just begin. I'll point out your name, and then just tell us your name, your professional background, or your interest, or your area of focus, and then what you're looking forward to this meeting, and then where are you coming, where are you joining us from, which country. So anybody can go. I'll start. I can see from my screen here, I can see Caroline. Caroline, are you able to unmute, share your name, your country, your professional background, and you're looking forward to in this session today? Diana, Caroline, please go ahead.
Greetings. Yeah, I'm from Kenya.
Okay, okay, okay. Thank you so much. You've not completed the entire introduction. Go ahead. Sorry for
Um,
disturbing. Yeah.
could you come again?
Okay. I was saying, just give an introductory, then a big like your name, your country, your professional background, and what you're looking forward to in this our session today. If you're able to do that, though I
Okay.
know, I'm just going to for the sake of those who are joining us here. Yeah.
Uh, so I'm in business. interested in the Pan-African issues, so that's why I joined.
Thank you. Thank you so much. Thank you so much, Diana, for introducing yourself. Also, so somebody who did join us here so much early. I love to give what is called Emmanuel. I just want to think so. But I don't want to think so actually. I want to know so. Emmanuel, just say hi kindly.
Good evening, everyone.
Yes, please go ahead.
My name is Oki Emmanuel. I'm a student at the University from Uganda. So the main reason I'm here is to learn new things, yeah, something new in the tech world. So that's it. Thank you.
Wonderful. Thank you so much. Thank you so much, Emmanuel. We're happy to have you. And we hope to see you really interact in this session to give the best out of you. If it can impact you, it can also impact somebody else. Otherwise, thank you so much, guys. Thank you. I've seen Onward joining us from Zimbabwe. Thank you so much for honoring East Africa community. I think we're also planning to have the Southern East Africa, the Southern Agricultural Digitization Summit actually next week. It's going to be first on agriculture, but now for East Africa, we wanted to have digital health equity as a foundational discussion towards actually promoting digital health. So we've been planning this same symposium for some time now, and I hope that those who registered are here to participate. Also, those who have joined us from WhatsApp platform, especially from media admin community, I think that is I shared it there. Thank you so much for taking time and joining us. So, without much ado, I want to begin by welcoming our speakers officially to just get an introduction about themselves, just to get to hear where they're joining us from, and then what they have for us, just to introduce themselves, their professional background, and their work. Yeah, everybody, for us to have this caliber of speakers, we had to look at what they're doing for the community and who they are and what they're speaking for. So I'll begin from the most southern country in the East African community. So, for those who don't know East African community, East African community now has got 11 countries, um, which is under the East African Economic Community. That is, we have Kenya, we have Uganda, we have Tanzania, we have Burundi, we have Ethiopia, we have Eritrea, we have Djibouti. Somalia is also one of us. We have South Sudan. We also have Democratic Republic of Congo. I think I've mentioned almost close to 11. So these countries are what make up East Africa Community, the EAC. But also we extend across the because the knowledge you are discussing here is applicable across the continent. So you can go to Zimbabwe in the Southern African SADC community or in the ECOWAS or even in the North Africa, and they'll still be relevant in actually impacting those areas. So I'll just begin with the southern. Our speaker from the southern part of the East African community, that is Victoria. Please just take time and tell us your name. Even if your country probably will be okay because sometimes you have to tell us what unique Tanzania is and also your professional background, just a brief description. And then from there, we'll head up to presentations and a brief panel discussion. Then we open the floor for everybody. Otherwise, Victoria, please take it up.
Okay. Good evening, everyone.
Good evening.
Thank you so much, Victor, for bringing us together. So I'm Victoria John Solomon. I'm from Tanzania, and I'm an assistant lecturer at the University of Dar es Salaam at the Department of Statistics. I hold a master's degree in statistics and bachelor degree in statistics. Moreover, I'm a researcher where my interest lies in health and SRH in general, sexual reproductive health, but also I'm into artificial intelligence and digital at large. So I find this session as more fruitful because it's gather us together to discuss the things that really matter to our continent and to East Africa at large. To be more relevant about my work, I have published one manuscript on modern contraceptive discontinuation among adolescent girls and young women, and some manuscripts are on the way. So yeah, that's all about me. But okay, I'm also a data scientist where I work with different clients and a researcher, consulting different organizations here in Tanzania. So you guys feel at home when you are in Tanzania, and welcome. Thank you.
Thank you so much, Victoria. Thank you so much for that introduction. So I think I've known Victoria for close to over 4 years now. Yeah, yeah. I think her work has been really outstanding in the space of technology. Very passionate about education. Actually, I think one of the most important areas is like she always reach out to youth, especially. Yeah, and also she's very passionate about technology, leadership, and health. Those are very. If you mention any of those areas, I think you always get her on point. Otherwise, thank you so much, Victoria, for honoring the invite to participate in our session today. I thank you so much because you've always been there for me and for the entire IDIA and what you do. So thank you so much for the opportunity, for your time. Actually, time is the most precious thing you can ever offer to a dear. Thank you so much. I'll welcome Mr. Patrick Okot, going to Uganda. Yeah, so Mr. Okot, thank you so much. First of all, can you just give a brief description about yourself? For Victoria, I think the reproductive, the link on the publication you can also share with us. Just to share on our platforms so people can actually click it in and access it. So, yeah. But anyway, let me go to our second speaker. Mr. Patrick, are you there? Please, you're welcome, sir. Thank you so much.
Yeah, thank you very much, Victor. Good evening, good afternoon. My name is Patrick Okot. I'm from Gulu, Uganda. I work at Gulu University as a lecturer. My background is computer science and information systems. I am also a health innovator. And at the moment, I'm doing a research on digital health, trying to look at how to link up local government health departments in northern Uganda to the national system. And I've been teaching at the university for more than 10 years. Yeah, I'm also a data scientist. I'm so much into databases. And I am a digital health advocate. Thank you.
Wonderful, wonderful. Thank you so much. Your profiles are really outstanding for me because I feel like one thing as common between you and Victoria is that you're both educators. You try to connect directly to the people. Yeah. So that passion actually is very key to empowering the entire because you build people. I also want to build systems and build platforms. So thank you so much, Mr. Patrick. I know you're going to still introduce yourself. You start introducing yourself and you cannot end. So for over 10 years, actually, is a lot of passion because I think once you hear longevity, like somebody has taken a long period of time, about 7 years is something. It is not just about because it's doing, it's about passion, not just for the work, but for the people it's actually building. So thank you so much for honoring us to join us this session. And I hope that you're going to interact to see all that you have for us. Otherwise, I don't know if Hannah is already here. Hannah, are you there?
Yes, Victor. Hi, everyone. Good
Yes.
evening.
Hi, please. Welcome, Hannah. Thank you.
Thank you, Victor. My name is Hannah Georg from Ethiopia. Currently at the African Digital Inclusion Alliance, I'm working like country director of Ethiopia, but my educational background is geology, but I'm not working on biology. I'm working, I use development activity in Ethiopia, focusing on temperatures, and other researcher I'm working, and additional I'm working on training and skill development at JJ Textile. Thank you.
Thank you so much, Hannah. I think Hannah has been really amazing from fellowship to the commitment that she has always been giving us in all that level. So thank you so much for taking time to join us today. And I know that you're very versatile. Like you're able to do leadership, do skill development, your professional background, and all that you're doing. So thank you so much for taking time to join. So I just want us to just do a round of applause to our speakers before they begin the session now. And I don't know if you're just able to use an emoji just to welcome our speakers. Anyway, before I go further, I also want to say that this week is Africa Digital Inclusion Week. Africa Digital Week is a commemoration period where we try to celebrate just more of create awareness on digital inclusion as an issue, as a very important component of our society. And as a dear, we've been doing this from 2020 three. We did it in 2024 and 2025. Here we are, and the first activity we are having virtually is the East Africa Digital Health Equity Symposium as a way to start our Africa Digital Inclusion Week today, Tuesday, which will be ending on Saturday. So thank you so much for taking time to join this session, everybody. And I hope that what you're going to be getting here is not going to end here, but it's going to be used as a stem or as a foundation towards actually making little impact. We don't just want to talk. We want to see all these things reflecting in our own academic, professional, personal experiences and journey. So thank you so much for taking time, and I hope that you really give it the best, your time and your commitment and a heart to receive and to use it as an impact, as a tool to advance yourself. Otherwise, I want to start with the presentation. And this presentation is just going to come from our first speaker who I introduced. I think we want to open up the discussion with digital equity, AI, and data. I understand that now we are in an era whereby AI is the hot cake in terms of the topic. We are using it in different professional settings. And I think that that is the best way also to start our session for today. So I want to welcome Victoria. I don't know if you're able to share or I'll share back. Just give us a direction, but we are here to hear from our first speaker. That is Victoria, just to give us a presentation on AI, data, and digital equity. Yes, Victoria, please, your floor is yours.
Thank you so much, Victor. So let me share my screen. I hope everyone can see my screen. Yeah, so I hope I've already introduced myself, and what I can say now is just it is a privilege to be here to speak about this topic that intersects my work and my passion, that balancing data and artificial intelligence in healthcare through digital equity. So why this topic matter? Should we speak? Why should we discuss about this topic? We should discuss about this topic because healthcare in Africa or in sub-Saharan Africa is in the moment of transformation. We are moving from analog now, we are to the digital world, which also affects our health systems and our health at large. On the other hand, we are seeing massive growth in the generation of health data, that we are now having electronic medical records, imaging, genomic data. We have mobile health apps. As in case from our country here in Tanzania, there is a lot of mobile apps. We have Dichunge app, we have Afya Call, we have a lot of applications that about health. I believe in also other nations, there is a lot, because this AI, this digital health is emerging across the globe now. So On the other hand, artificial intelligence is maturing to the point that it can read X-ray, it can triage a patient, and can optimize the delivery of medical supplies. We will see some cases in the next slide on how AI have benefited this field, this health field. But with all the benefits, with all the transformation, with all the transfer, there is a critical question. How do we ensure that this transformation benefits everyone, not just some of people? And that's where digital equity comes in. So digital equity, it means that everyone, regardless of geography, regardless of gender, regardless of education, regardless of income or any socio-economic, political.
Hello, Victoria. Are you pushing the screen? I don't know if it is only my side. I can't see it moving. Okay.
I think I'm still in this screen.
Okay. Thank you. Sorry for that. Please go ahead.
Yeah. So has fair access to digital. Okay, everyone has fair access to digital tools, has fair access to digital skills, and has opportunity to benefit from these digital skills, digital tools, digital technology at large. So my goal to this session is to show you what AI and data are already doing for healthcare in Africa, the risks and challenges that we must take serious. We'll show some case studies that have been done in Africa, but also see a practical framework to balance innovation and fairness and the recommendation. So let's start with the promise of data and AI in health care. Artificial intelligence is not now like a science fiction anymore. In healthcare, it's already being applied in ways that are transforming outcomes. How? There is a speed and accuracy in diagnosis. As we see, AI can read radiology image. We see AI flag abnormalities with speed and consistency that support doctors. Previously, doctors were doing a manual work to read these images, but AI can just do it in a second. Okay, as I'm speaking now, I was in the program of trying to see how AI can help radiologists, how can help oncologists to diagnose breast cancer. So we had like some of, I heard Mr. I think I don't remember clearly, but mentioned that he is also in data science. So in that project, we are trying to see the deep learning, how machine learning can be applied to assist a doctor to screen a breast cancer patient, and can read those mammogram images and ultrasound. So it's in the system, it was just done in just a second. So we see how AI is now, how AI can do a lot as now. So, and how accurate is, because the system that we are trying to develop, it had the accuracy of 99%. So that's all about AI. But we also see in different programs how AI has a predictive power for outbreak. It has, if AI has been feeding a perfect data, a good data, if a good algorithm is being created there, we see how AI can forecast outbreak. There is tools that have been made to forecast outbreak of malaria. There are tools have been made to forecast outbreak of cholera, COVID, and so and so. So these tools are used to help health system to prepare in advance. So AI help us to make prediction about what is coming in this health care field. Now, there is efficiency in logistics. We'll see in the case study, we'll see how AI can optimize logistics, ensuring that medicines, vaccines, and blood supply reaches where they are most needed on time. And now I think this shift indirects in the concept of digital equity. Imagine those who are in rural area, how AI can help them, if not helping them to optimize their logistic, if not helping them to ensure that the medicine, their needs are being fulfilled in time. So regardless of the environment they are in. So that's another promise of data and AI in the healthcare. But also this data and AI facilitate the accessibility through telemedicine. We'll see in the case studies, and it's also helps in personalization of the treatment. With the right data, AI can tailor treatment and prevention plans to individual, improving their adherence and their outcome. So with those promises, but there is also the risk and the equity in the of these challenges. So what are the equity? We've seen how AI can amplify gains, but now it can amplify inequalities, and these are the key issues. The first key is bias in AI models. So if the training data comes from Europe or North American, the AI may not perform well for African populations. As we all know that we don't have a lot of data that we can feed the AI so that they can provide us the models which are more adequate to our context. As we know, social characteristics of Europe, social characteristics of North America or wherever, they are quite different from our context. So, but most of the tools that are being made here in Africa are based on the data that comes mostly from Europe, almost from America, which are not relevant to our continent. So this AI may not perform well for African populations. Our social needs, our health needs are quite different from those from in the Western countries. But also, another risk is data and privacy security, where health data is deeply personal. So weak protection could lead to misuse or even discrimination. So if these AI tools that are being used will be having a weak protection, then it will lead to the discrimination or misuse of this information. But another risk is the digital divide, which is the core issue that we are discussing today, as many rural areas lack internet, electricity, or even smartphones. So if AI tools require high bandwidth or expensive devices, large population will be excluded. So that's another risk or equity challenge of the AI. But also there is trust and cultural acceptances. We know in the rural area, even urban, it's very hard for people to just adopt a new culture. It needs a series of training, a series of changing habit, behavior, and so community may not trust AI-driven solutions unless they are explained clearly and culturally contextualized. So this is another thing. As we know, AI is moving too fast. There might be good tools that will help our digital health, but how will society perceive them? Will society be comfortable with them? How? So the acceptance of society also is an issue based on the speed of AI that is working right now. So lastly, there is workforce readiness. Not only the society, not only the community, but also how about our healthcare workers? Our healthcare workers need to be trained and integrated well. Otherwise, AI tool may be burden rather than solutions. As I mentioned, that adoption sometimes is hard in our community. So this is why digital equity is not negotiable. AI in healthcare should not only improve national statistics, it Also, we also need this AI to improve outcomes for most of the vulnerable, especially rural women, rural income communities, and those marginalized groups. So let's check the case studies that AI has worked. The first one is from Rwanda and Ghana, Zipline's drone delivery. So in Rwanda, Zipline partnered with the government to deliver blood, vaccine, and medicine supplies through drones. Independent evaluations found that these services significantly reduced delivery time and minimized blood wastage. For example, okay, let me explain how this worked. Instead of a rural clinic waiting hours for a delivery by road, a drone could deliver in under 30 minutes. So we see how AI has helped this initiative. In Ghana, also drones played a crucial role during COVID-19 pandemic, where they were transporting test kits and PPE across vast regions. What does this tell us? This tells us that data-driven logistics, if there is a data-driven logistics and AI is enabled, so it will literally save lives by crossing last mile's gap, I can say that. But also, this works because the government invested in integration with the health system and ensure rural clinic has equal access. So this is the one concept that digital equity has been a success. As we see how these drones help those who are in rural instead of waiting for a lot of hours, but in just 30 minutes, the drones will deliver blood, will deliver vaccine, will deliver medical supplies in rural areas, which has no or has limited health centers, has limited resources as well. So that's the case of Rwanda and Ghana. Another case is also from Rwanda. Rwanda is always, Rwanda is doing good in technology. I have to admit this. Yeah, and another case is about a telemedicine partnership, which Rwanda provide another AI solution that is Bible telemedicine service. And this was the public and private partnership that allowed patients across the country to go into a digital system, receiving primary care advice and referred to clinic where needed. I guess there is this initiative because even here in Tanzania we have Afya Call, where you can make appointment with the doctor, where you can get some primary information after feeding it with some information about your health, and some sort of that. But this one is in a national level, where by 2020, Mobile had millions of registered users, as you can see, with the population of Rwanda. But this project has millions of registered users. What that this shows? It shows that it shows how digital tools can extend healthcare access to rural and low-income population, provide the cost is kept low, and the system is supported by service. So, however, the challenge was also clear. Network coverage in this projects, the issue of network coverage, user digital literacy, and maintenance of the patient trust, because in this program, users were required to sign in that means they needed to have a digital literacy. So regardless of the will to help the community, but yet there was a challenge of digital literacy. So if someone does not know how to use digital tools or does not have the access to digital tools, then he or she were excluded. So what does this remind us? It reminds that access is not just about having the technology, having good initiatives, but about how we make it usable and equitable to our communities. Yeah, so that's case number 2. And case number 3 is from Zambia, and it's about AI cervical cancer screening. I say we are working on the AI breast cancer screening, but Zambia did for cervical cancer. And I think we know that cervical cancer right now is the leading cause of death that are related to cancer globally. So it's a disease that we need to, government, NGOs put a lot of effort in preventing it and curing it. So this case study from Zambia shows how AI has succeeded, and some shortcomings as well. And it was in Lusaka. The researcher validated a combination of HPV testing with AI-based automated visual evaluation of cervical cancer images. This AI supported nurses to triage a patient in low-resource clinics. So after this intervention, research showed that the approach was highly promising as a scalable, because it also had a low cost. It used a local screening method in setting where trained specialists were scarce. We know that we have few specialists, so the solution like this actually bridge that gap in our community, especially in the low middle income countries as Zambia, as Africa at large. So after this intervention, we have proved that AI can empower non-specialist health workers, expand preventive care, and directly save women's life when equity is prioritized. So that's another case. But the last case, in the case of AI for tuberculosis screening, that involved a number of countries, including South Africa, Tanzania, Lesotho, and Zambia. This was facilitated by the WHO in 2021, where endorsed the use of CAD for TB screening after multiple studies show that tools can perform on par with radiologists in triaging the patients. So this case study also is transformative in regions where radiologists are few, or maybe there is no radiologist at large. At least it can give a primary result that can help health workers to assist that patient. So CAD allow mobile TB clinic to scan thousands of patients in rural areas quickly, flagging high risk cases for confirmatory testing. But again, the success depends on ensuring that rural clinics have the machines, staff are trained, and to interpret the AI output, and referral pathways are clear. So these are the few cases of how AI work in our continent, in our context, and how it has succeeded. So we see we're in a good position, but if we still don't consider those who are marginalized, those who are vulnerable, those who are not in privilege to accept this, we shouldn't call ourselves as succeeded ones. So yeah, so now let me have a framework for balancing innovation and equity at the same time. What do we need as Africa? What do we need as East Africa? What do we need as a continent to balance innovation, to balance this AI, but with equity? So as these cases, a clear framework emerged to balance data, AI, and healthcare delivery through equity. We must prioritize these 4 pillars. And pillar number 1 is ethics and governance. What do I mean by ethics and governance? In ethics and governance, I mean that we need to have strong data protection, that we should make sure that we have a strong system that our data will be all protected, because health data are sensitive data. But also we need transparent algorithm and human oversight. But also, number two, we need inclusive data and validation. We have to ensure that African population are represented in the data set. We have to validate AI tools locally before scaling it. As I mentioned earlier, most of the data set that are used for training our models, we use maybe a data from Europe, which we can access more data from America, but how do they well explain our context? They don't explain our context well because of the nature of the population is quite different from ours. So we need to ensure that our populations are represented in the data set. We need to validate our tools before scaling them. We need to make sure that our tools are more accurate, so before we scaling them. Number three, the third pillar is access and infrastructure. We need to invest in broadband, offline first apps. For example, offline first apps, affordable devices, and user-friendly interface. So these things will help those who don't have access to internet, those don't have high digital literacy, to also be accommodated, to also have access to these tools, to also have access to these interventions. And lastly is capacity and overflow. We need to train our health workers. We need to train our community, regardless of who they are, where they are coming from, and what are their status. We all need to equip them with necessary skills before making an intervention. We also need to integrate AI into existing referral systems and monitor outcome for equity, not just efficiency. We shouldn't just focus about how efficient the tool is. We should also focus on how equitable it is. As when I was pitching about the idea of that AI-powered breast cancer screening app, I was just asking one question, like, so you are developing a tool for helping radiologists or oncologists to screen a breast cancer patient, but in the whole population of Tanzania, how many women have already screened for breast cancer? We came to realize it's only the 5% of women who are screening for breast cancer, while breast cancer can just, any woman can just get a breast cancer. So it was a concern that the solution was not about, the problem was not about screening. The problem was not about, it was about the awareness to this woman about screening. So in this case, the tool had to focus on influencing, on raising awareness to the community about the screening of breast cancer, because if it's only 5% of the whole population, and that is where the problem is. So this AI tool, we should not just monitor outcomes for equity, but also we just need, we should also monitor outcomes for equity, and not just how efficient the tool is. And this is how we are preventing, and this is how we prevent AI from becoming another drive of inequality, and instead make it a tool for fairness. Now, this my recommendation. Recommendation number one is to build national digital health strategy that mandates access, equity indicators like rural versus urban usage rate. So my call is for government to have a digital focused, equity focused digital health strategies. We might have the statistics of how these tools are being used by rural population, by urban population, by women, by men, by those who are living with, people with disability, with those who are disabilities. With this rate, will help us to know which group are left behind. But also, we need to pilot AI tools with equity metrics from day one. Before scaling a tool or a solution, we should ask ourselves, who is excluded? Who benefits the most? If we ask ourselves these two questions, we get the answer if this tool or if this solution is equitable or not equitable. But also, I call for tech companies to publish validation results, disclose datasets composition and design for low bandwidth context. So if we publish the validation results, it will give us an eye to see how things are. And for the if they design the tools that accommodate low bandwidth context, at least it will help those who have low internet access to benefit from the AI and from the data in this field. Lastly, I call for academia and researchers to collaborate across borders to create African data sets that reflect our unique populations and diseases. Above all, we must be a design principle, not an afterthought. So that's my presentation. And that's my simple roadmap for the pilot. First, we need to define a measurable outcome, and after you define a measurable outcome, select a validated AI tool by considering who benefit the most and who has left behind. We need to define equity indicators as per solution that is provided. But also, we need to train staffs and pilot for at least 3 months and evaluate and scale responsibly, because if we do all these stages, we'll revert with a tool that will help to reduce digital inequality. Above all, let me close by this thought that AI is a powerful amplifier. It can amplify efficiency, it can amplify accessibility, it can amplify accuracy, but it can also amplify bias. It can also amplify exclusion and inequality. So the choice is ours. We stand at a point Africa can be a leader in showing how how to deploy AI in healthcare responsibly, ethically, and equitably, as we saw in those cases. So let's ensure that the most vulnerable benefit first. If we put that in our minds, whenever we develop a certain solution, that the most vulnerable benefits first, that will be the leader in showing how AI can be equitable. But before I leave today, I would like to leave you with a question, which is so simple, that how will we ensure that next AI-driven health intervention reaches the most vulnerable first? I think this is the thing that you have to take from the whole presentation, that how will we ensure that the next AI-driven health intervention reach the most vulnerable first? If we consider that, I'm sure bridge that gap, that inequity gap in healthcare delivery. All in all, thank you so much for listening. We can connect via LinkedIn. My LinkedIn handle is Victoria John Solomon, or for any inquiry, you can email me via the email I have provided. Thank you so much.
Wow, wow, wow. Thank you so much, Victoria. I'm so much happy with the presentation. That's been really enlightening and truly captured a lot of information that is very foundational and very key. Like they are foundational, key, and important. Actually, even if we were to say that this presentation is what we have received today, I think we've done a good work, really done a good work to give us a very big picture of what actually data, AI, and digital equity actually mean, not just from the point of generic focus, but now from a case study point of view. And I'm so happy that you really pointed out Rwanda as a very key major country that has really been a very key country in terms of promoting digital equity. So thank you so much just from giving us the digital equity challenges, the AI, the indicators, and all these. I feel like you really shaken the foundation of digital health equity as a critical conversation that we need to actually continuously have. So thank you so much. I think I'll just open the floor to those who can have a question. Please, you can just type it in. Type the questions you might have for Victoria, and also we are going to avail this recording to those who might not be able to join us because not everybody has been able to join us this evening. But we're going to be having this recording available. But thank you so much, Victoria. I think we can have so many questions regarding what you really presented here. Yeah. And the first thing I'll just say is thank you so much for the expansive. It was like a very short presentation, but also carried a lot of weight. Yeah, so thank you so much for actually expanding on it in a very broader way. Otherwise, I think I'm seeing some comments on the section there. I'm seeing a pen asking for sharing the document. Definitely, that can be shared definitely. And I think Victoria will share two things. Your email address, please do share in the chat box, and your SHR, the social health reproductive. Is it the social sexual? I think it's sexual health reproductive something, right? Yeah, so people can follow that. Please read that publication. We don't just public them for the sake of, but we want people to read them to be aware on the statistical background of what we mean by that. Otherwise, I want to welcome Mr. Patrick Okot to just give us. He's going to give us a general statement on this topic. I know he was to share deeply on this, but because he didn't really capture it in the presentation, you know, educators and lecturers are ever lecturers. You can stand wake them up in at 3 a.m. and tell them and do a presentation, and we'll just go and do it. Otherwise, let me welcome Mr. Patrick. Yeah, please welcome, and I see you have something though. Karibu.
Yeah, thank you. Thank you, Victor. Good evening once again, everyone from different parts of East Africa. Yeah, my name is Patrick Okot. Those are my details, my contacts, in case you want to reach out to me. Yeah, and both LinkedIn, Facebook. Yeah, those are my details. Yeah, I'm going to talk from a general perspective, just like Victor has mentioned. Yeah, I want to start by thanking the organizer.
Is it only my side? Huh? Really? Can't get you. Can someone help me get? Okay, please go ahead. Can you get me? I don't know if it is my side or your side. I can't get you.
Can hear you.
Mr. Patrick, okay, please go ahead. See, your voice is lost, Mr. Patrick. Oh, I can also see Mr. Tendai. Mr. Tendai, hi. Thank you for joining.
Sorry,
Yeah.
sorry, I'm connecting.
Okay,
I'm
okay.
connecting via my phone, and I received a call. Sorry.
Oh, it's fine. Well, just take your time. Please don't panic.
So how are you?
Oh, we are good. How are you, Mr. Tendai? Thank you so much for taking time to join.
Yeah, yeah, it's a pleasure.
Yeah, thank you.
Hello.
Hello, we can get you clearly now and you can see the screen clearly. Please go ahead.
Okay. Yeah. So I'd said I was going to share from a general perspective of this theme. Yeah, this theme, digital equity, accelerating digital health delivery, could not be more timely. We see that across East Africa and even Africa as a whole, we are witnessing a growing recognition that the health of our people is no longer shaped by only the medical infrastructure or clinical practice, but equally by our ability to harness digital innovations in an inclusive and equitable manner. So digital tools are now reshaping health across East Africa and Africa, as we can see from different mobile health apps being developed, and also telemedicine to electronic records and AI disease surveillance, like my sister Victoria has mentioned. But for many communities, we also see that these innovations remain out of reach, like due to poor connectivity, affordability barriers, and also limited digital literacy among the communities. Yeah, but the reality is that according to the International Telecommunication Union, 2024, only 36% of Africa's population has internet access, compared to the global average of about 67%. And in rural East Africa, that figure is even far lower. So if we do not address this divide, then the digital health may deepen the inequalities rather than reducing them. So we therefore would face a lot of risks. And we know that over the past decade, digital health technologies that are ranging from telemedicine platforms, mobile health or m-health applications, electronic health records, AI-driven disease surveillance systems have transformed healthcare access and delivery. In Uganda, for example, where I come from, we have some mobile-based platforms that are being used to connect like rural mothers to skilled health professionals. Yeah, while also the digital records are improving the continuity of care in the local government health facilities. But alongside this progress, there remains a digital divide. Many communities, especially in the rural and the underserved areas, still lack like reliable internet, affordable devices are not there, and also the digital skills are not there. So without bridging these gaps, digital health innovations still risks deepening the inequalities rather than reducing them. So how do we use digital equity as an accelerator of digital health. So the true acceleration of digital health delivery will only be possible if we advance digital equity. So what do we mean by digital equity? This is ensuring that every individual, regardless of geography, gender, income, or ability, would have a fair and meaningful access to these digital tools, infrastructure, and skills. So digital equity is not a luxury. It is a prerequisite. So just like we consider water and electricity as being essential enablers of health, so must we recognize like our equitable digital access as a determinant of health outcomes in this 21st century. So digital equity is therefore not optional. It is the cornerstone of acceleration. So just like Nelson Mandela, that health right. So today, digital access has become part of that right. And then by equity, we mean ensuring that every person, regardless of where they live or who they are, has a fair access to the digital tools, the infrastructure, and the skills. So what are the key pillars of digital equity in health? The key dimensions. Allow me to highlight some 4 pillars that are critical, that I think are critical for digital equity in accelerating health delivery. One is infrastructure equity. We have to expand affordable internet coverage, strengthen the last mile connectivity, and ensure a reliable power supply in the rural health facilities. Yeah, I, for one, am trying to bridge the digital gap between the local government health departments in the rural areas and those in the developed cities. You find that they still lack that kind of connectivity because they still depend on the traditional way of health records management, which is making them to lag behind. Number 2 is accessibility equity. Designing digital health solutions that can be user-friendly, that can be multilingual and inclusive, even for persons with disabilities, the elderly, and the marginalized populations. Number 3 is affordability. This is making sure that the digital devices, the mobile data, and e-health services are cost-effective so that no one is excluded because of poverty. So this is a very key thing at the moment. The main problem at the moment, I would say, is affordability. Internet services are still very expensive. Internet data is very expensive in Uganda, East Africa, and even the whole of Africa. And I believe all of you can testify to that. Then the 4th pillar, the 4th major pillar is literacy and skills equity. We need to look at building digital literacy capacity among the health workers and the communities to ensure that they can meaningfully use the digital health tools that will be developed and delivered to them.
Maziwa aliniita nikipita. Ananiuliza tukuni tulienda.
So what are the opportunities for East as East Africa? We stand at a unique ecosystem. We have an opportunity to leapfrog our traditional barriers. East Africa is uniquely positioned for transformation. For example, mobile penetration in sub-Saharan Africa is above 50%. And in countries like Kenya and Uganda, we have mobile money adoption that exceeds 70%. This shows that when technology is accessible and affordable, communities can adopt it rapidly. So by integrating digital equity principles into the national health strategies, for example, we can ensure that, for example, a patient in Karamoja in Uganda can receive the same timely medical advice as a patient in Nairobi or Dar es Salaam. A midwife in rural clinic can update medical records with the same efficiency as a doctor in Kampala or Kigali. And a child in a refugee settlement camp has equal access to health education through digital platforms, just like a child in an urban school. So what's the way forward? Call to action. Colleagues, accelerating digital health delivery in East Africa and Africa will require more than just technological innovations. It demands policy commitment, cross-sector partnerships, and investment in what? In equity-driven approaches. So I call upon governments to integrate digital equity targets into the health and ICT policies, to develop partners and donors. Development partners and donors should prioritize funding for infrastructure and capacity building in underserved areas in East Africa and beyond. Then the private sector innovators should design solutions that are inclusive, affordable, and scalable. And then our civil society and advocates, like many of us, to continue championing the rights of all citizens, like to equitable digital health access. So those are some of the things that once done can lead to an equitable health services delivery in East Africa. So in conclusion, I would like to say that digital equity is not just about closing the connectivity gap. It is about closing the health gap. It is about ensuring that technology becomes a bridge, like to better the health, but not as a barrier. So if we commit to equity, then digital health will not only be accelerated, but will also be transformative, reaching the last mile, saving lives, and shaping a healthier and more just East Africa. So just like the African proverb says, that if you want to go fast, you go alone. But if you want to go far, then you go together. So let us go together with equity for a healthier East Africa and Africa at large. Thank you very much for listening. That is what I prepared to share.
I've got a question.
Yes, back to Victor.
Victor, I've got a question for Patrick. I've got a question for Patrick.
Yes, please.
Oh yeah, I wanted to find out, you talked about affordability. And what about those poorest of the poorest? How can you come to help them out?
That I would think would require government intervention. Just like I have in the call to action, governments should integrate digital equity targets so that those in the rural areas, those who are in poverty, can also be considered by providing them accessible and affordable services. Yes, Victor.
So you talk of subsidies from the government.
Yes, please.
Just go ahead. Just go ahead.
Okay, thank you.
Okay.
You're
I
welcome.
think we were yeah, it was on Let's Go Together, on promoting child equity and make sure that Africa actually rises. So thank you so much, Mr. Patrick. I think you've also expanded this in a very bigger way. Actually, I've sure of what like even me, I'm near learning because all these statistics I'm not a very big fan of statistics in terms of learning. So most of the time my mind is always very theoretical. But now when it comes to such symposiums, I learn because if I can see that picture where somebody in Kigali compared to somebody in a rural setting doing the same thing, I feel like it brings clear picture of what actually equity means. So thank you so much. And I feel like if you have any question, please, for Mr. Patrick, kindly just raise up your hand and put it here. And then also, I think if next year, probably, if we're able to work hard and have this symposium even physically, it can be very good because it can now allow us to connect well. But also, as ADIA, I think I just want to bring this before I usher the last presenter is that we are planning to build capacity for digital health equity promoters. We want to raise people who are called digital health equity promoters. People are able to actually stand in the gap to promote digital equity in digital health settings. Because we have digital health innovation from apps, programs, but at the end of the day, equity is not a major foundation. And equity that does not just mean is for refugees, with disability, or the less marginalized people. It's for everybody. Equity in our context as ADI always means that is foundational to everybody. Everybody has a certain form of need. Can be digital device, can be the use of that device, can be a platform, can be a skill, can be a technical support, can be a knowledge gap. And if you check the digital health ecosystem from the point of a patient, a doctor, and the digital tool itself, it means that there has to be because everybody is not equal. The doctor might not know something, the patient might not be aware about something. We also have the geographical context where we have the rural and the urban and the peri-urban settings. All these present to us a way to actually step in and be the bridge. So as we continue with this session, I think now we have a picture of what actually digital health equity means. And now for the East Africa community, which has been pointed out clearly by Mr. Cott and even the entire continent. And Victoria also gave us a picture of AI, data, and healthcare. All these are to build foundation so that we're able to stand in the gap to promote digital health equity in a very, very bigger way. So thank you so much, Mr. Patrick. Please, if you have any question, feel free. I'll also try to access the presentation from Mr. Patrick, and then I'll share with the platform. Otherwise, I want to welcome our last presenter. I think it's going to take a very short period of time. That from there we can open the floor for everybody now with a comment and with any other point. I just want Anna to take a few moments just to share, uh, just just to share about digital health context in Ethiopia. In Ethiopia. So I think I'll help us share.
Okay, thank you, Victor. Can you share, please, PPT? And thank you, my colleague, your nice presentation, Mr. Patrick and Mrs. Victor. Miss Victoria, can you please, Victor, share the PPT? I'm heard double. Victor. Victor, I'm heard double.
I think he is sharing.
Okay, Patrick, thank you. I'm heard double now, right?
You are very audible.
Yes.
You are very audible. Very audible. Yeah. Thank you so much, Anna. Please go ahead. Ethiopia is waiting. Want to see something happening in Ethiopia now? Can you see the screen now, Anna? Please go ahead. Is it visible on your end?
No, it's not visible for me. Can you guys visible for the other? It's okay for me. Patrick, can you confirm the PPT is visible?
Can someone see the screen?
Yes, yes, I am seeing the PPT.
It is there. It is there. I don't know.
May you do slideshow?
I can go by. I can open for me if the other is visible. It's okay. Now it's came for me.
Yeah, perfect, man.
So my today my topic is my agenda is to describe Patrick describe, Victor also describe very well. But what is digital health? What is digital health? Ethiopia social economical context. Digital health in Ethiopia. What is the economical context and the SWOT analysis in Ethiopia? What's the strengths part of indicator strengths in Ethiopia, the weakness, opportunity, and the threat. The threats, the other one is the key finding in Ethiopia. So this is the agenda of today topic, today my presentation. So the whole, my colleague also describes this very well. The digital health means, but in the name we will all understand what digital is. E-health. E-health means everyone or everyone. If the phone is Android or smart, they can accessible to health. That we call it digital health. So digital health in Ethiopia is currently very expanded, but it's limited now. More in rural area, still not accessible, but in urban area is very accessible. Digital health in Ethiopia. Social context. Currently, most of health centers are using this platform to their income. Also, we can see in this Ethiopia also focusing on industrialization core of economy over the last dedicated, and Ethiopia has made a growth of 10% because in Ethiopia we have a lot of industrialization came to now. So to decrease unemployability. So in Ethiopian policy, we depend on digital system. That's the social economic context we saw it in digital health system. What's the weakness of our parties and what's the opportunities? What's the threats Ethiopia are faced now? So that's SWOT analysis means, everybody knows well. So the strengths of the Ethiopian digital health system is more young people, high young and growing population in Ethiopia. That means most of young currently 75 of total population are in Ethiopia use. This one is one of the strengths. Most users are adapted and flexible to using digital system. That's the strength now. The country has also significant leadership for digital transformation. Like currently in Ethiopia, we use digital ID, digital every access currently now is a banking system. Uh, most every parking, pharmacy park, everything is now a digital system. So our policy is encourage our digital system. That one is our strength. The weakness part of the weakness as in Ethiopia, we face it. The weakness, our weaknesses, we have a data limitation, and the data of infrastructure. We have two the telecommunication provider in Ethiopia. One of them is governmental, Ethiopian Telecommunications. The other one is Safaricom. Safaricom is famous in Kenya, I know it. So, but still infrastructure is not expanded. Also, the donor of this kinds of telecommunication is only government, not private sector are involved in this issue. That's our weakness. Currently, we started like Safaricom like that, but still we need to be improved. So financial commitment also limited in Ethiopia. That's the weakness part of in Ethiopia. So opportunity with opportunity as in Ethiopia, the opportunity we have, like regionalization opportunities we have, like AU is in Addis in Ethiopia, big Ethiopian airline is the biggest our travel hub. Other industrialization are we have currently import so many foreign industries in Ethiopia. That's our opportunity to expand it, our digital health. The other as like challenges or we face in treatment and threats, our cultural complexity. Our culture is not supported digital health system. Like the religious father is not supported also. Our language sometimes it's difficult. Everything languages our most of the digital health system is by English. That's that is our challenges currently. Most of people like rural area is not understand in English, so most of Ethiopian people are using Amharic. That's one of the challenges. So we
What?
in
Say
last rest.
what?
Hello.
Go ahead, please.
Lack.
Just go ahead. We can get you. We can get you clearly. Go ahead.
Okay. So lack of trust also in government sector, like it's telecommunication, something like that is not trustable that much in Ethiopian context. This one is one of the trust. The threat of in Ethiopia. So the key findings we have in Ethiopia, the key finding is limited private sector innovation. Currently, is not involved in these industries. We have limited donors. The only the donor of this area is government. So this one is not enough to improve our digital health systems. So the other one is the final thing is the existing digital strategies do not included in landscape or the key pillar of digital health ecosystem. That's the final thing. Thank you, Victor.
Thank you so much, Anna. Thank you so much for your wonderful position on that note. I think you've given us a picture of what actually Ethiopia looks like. And from the over 100 million, yeah, there are over 100 million people in Ethiopia. That is the second most populous country in Africa after Nigeria. Yeah. So it means that when Ethiopia is truly industrialized, we cannot just witness the change in East Africa, but the entire continent of Africa. And being that Ethiopia is also the capital city, is more of like the hub, the continental hub of unity, the unity of Africa actually stems from Ethiopia. We understand that all that we do, we reference a lot from the flags and everything is originated from Ethiopia. So thank you so much, Anna, for that presentation. I want to open it up to the floor now. I think Anna has given us just a picture of how Ethiopia looks like, the population, the weaknesses they are having, and if you can check very well, the problems that Victoria stated, the one that Mr. Patrick actually highlighted, and the one that Hannah has concluded with are interrelated. And it means that we have to be at a point whereby we're able to build it not just for the sake of health ecosystem as it is, but now for the sake of the people. Our people are multilingual. We speak different languages, local languages. Infrastructure is still a big challenge here. Yeah, the policies are very fragmented. The digital health ecosystem, the under-resourcement between the rural and the urban population, the literacy capacity among the patient, the healthcare workers, the workforce, the data inefficiency or data scarcity or more poverty, that data poverty that is existing, whereby we don't have enough data about ourselves. So we export from the Europe, and what we use does not reflect who we are. So it end up um, conflicting our identity and what we want to use. So I think digital health equity is being a conversation that is very foundational, not just for the sake of talking and finishing this symposium, but make sure that all that you're going to be doing from health is going to be building up our next move. So I want to open up any question, please throw it on the floor. And if you have any other comment, feel free to make it here that we're able to hear from you. So if you have any comment, please, I'm opening the floor for comments and questions. Raise your arms. You can just show up your hand there and you make a comment or a question. Onward, do you have something to say regarding policies and digital health?
Yeah, I just love to thank everybody who managed to give us a mouth-watering presentation. The presentations were outstanding. I was actually also learning about the issues to do with the health sectors. Yeah, I can actually admit that when it comes to the issues of digitalization in Africa, Rwanda is a perfect example of digitalization because I believe it's up to something which is different than what most of the African countries would like to do. Rwanda have got its own approach, which is also a good model. Yeah. So I was actually learning a lot.
Thank you so much, Onward. Thank you so much for that wonderful comment. I think that is more of a congratulatory and also just commending the speakers for the wonderful presentation they have actually presented onto us. And thank you so much. Let me welcome Jemima. Please go ahead and share your comments.
Thank you. Sorry, I'm late. I was so much inconvenienced this evening, but I want to thank all of us for showing up, and the presentation on digital health is so inspiring. So I want to talk on the point of disability, because there are a lot of challenges that exist, and digital health has offered interventions that offer new ways to support individuals with ASD, that is autism spectrum disorder, and their families. We see that with the development of AI, we have parents supporting their kids' social skills, communication, and behaviors that they can adapt in their lives. So it is good that we have this discussion, and it has digital health has potentially led to virtual autism, and it has affected so much the real world interaction skills like eye contact and engagement, which I can say it is one of the disadvantages, but we can't deny its benefits. There are more than the disadvantages. So I want us to soldier on and support the platform of digital health. Let us be the voices too, and for the development. Africa will be there too, because I know we are quite behind, but we are developing very fast. It is so rapid, and I know there will be change. Thank you, Victor. Thank you all.
Thank you so much. Actually, Africa is at the right time. We're not behind. If you compare us with the West, with the standard of the West, we are behind. But with our own standards, yeah, yeah. If we start compare, if you want us to be like the West, we are behind. But if you want us to be Africa, we are at the right place. So I thank you so much for that wonderful. Actually, I'm the virtual autism. Yeah, the virtual autism. Like it's not a disease. Actually, it's a disease now. Yeah, it's something that is now affecting us, and I think that disability is not a time we could come and talk about digital health equity without pinpointing on that. So thank you so much for bringing that in. Any other question or comment as we finish up our session? Yes. Any other comment?
Thank you. Yeah,
Okay,
thank
please
you,
go ahead.
Victor. Yeah, I've just been thinking aloud here, and I was like, from all these presentations, what kind of products are we going to get out of all this? So I was just thinking that is it possible to have some collaborative research where we can do publications together as a team? And that's just because, like, as we are in academics, we always look at, informing the community out there via publications, disseminating the information. So I would really love to collaborate with the members if we could find out something concerning this topic that can bring us together and we share our experiences from the different countries. And then we put this into an article that can be published. I don't know
Definitely. What a
how.
wonderful.
Yes.
Yes.
Thank you.
That is truly a very wonderful present idea. I think from the team we have here, we have people who are very passionate about digital health. From my perspective, people like Jemima who have been in this health space for some time in terms of disability matters. And I believe that with what we presented here, it is enough proof to actually give us a picture of where we really want to go. And as I was even coming to the call to actions, and I was saying that this is the East Africa Digital Health Equity Promotion E-Symposium, which is virtual. So we need to plan a physical one, which we're planning to have. I think I had proposed to Mr. Patrick that we can have it in Uganda next year, probably. And then also next year, we are looking forward to train digital health equity promoters. And these are people going to be adopting a mindset of digital equity in health perspective. And because ADI is not just an organization that seeks to talk, talk, and talk, we also try to have around our work, build products that are able to accelerate what we do. So this symposium was just foundational, just to create a foundation for what actually we mean by digital health equity. So that even if you're going to be publishing it there in the public, people are going to be unable to interact with our content. So if you're planning a physical one, we are not able to have that courage. And then also on the research publication we can partner on. I think this is something we can draft, look at the topic we're going to be focusing fully on this as if it is health equity. Looking but this health equity is something that is very growing. Actually, only that in Africa we tend to overlook it because we still don't see the money side of it. Africa anything we only do things. Most of us are motivated so much by let me do it what I get. But now the computer is still underground, but I think we are the right people to push it and to make it a public there. And this is the foundation. I think on that publication we can actually make it work out. Otherwise, if there's any other comment, I think I want to welcome Mr. Tendai. You can't go without at least saying hi. Even Diana, you've been here for some time. It's good to hear your voices as I share the the AU anthem. As ADA, it is our policy to always begin with African Union anthem and stop with it in every meeting, because we believe that one day Africa will truly unite and give us an ease in how we operate. So, as I welcome either Tendai or Diana to make some comments, please go ahead.
Oh, thank you, Victor. I think I'm satisfied with whatever is happening, and I wish to leave now because I've got something to do.
Okay.
Thank you, Victor. Thank you, everyone. Bye-bye.
Thank you.
Let us all unite and celebrate together. The victories won for our liberation. Let us dedicate ourselves to rise together to defend our liberty and unity. All sons and daughters of Africa, flesh of the sun and flesh of the sky, let us make Africa a tree of life. Let us all unite and sing together to uphold the bonds that frame our destiny. Let us dedicate ourselves to fight together for lasting peace and justice on earth. All sons and daughters of Africa, flesh of the sun and flesh of the sky, let us make Africa the tree of life. Let us all unite and toil together to give the best we have to Africa, the cradle of mankind, the font of culture, our pride and hope at break of dawn. All sons and daughters of Africa, flesh of the sun and flesh of the sky, let us make Africa the tree of life.
Wonderful. Thank you so much, everybody. And let's connect our official conference coming up in November. But also, we are still continuing the Digital Inclusion Week. We're going to be having a virtual session on Thursday and Friday. And we're just going to update everybody. Thank you so much, and bye-bye for now.
Thank you. Bye.